Hi, this is Jade Aquino from 3DVM-B, and today let's continue the topic, drugs acting on endocrine system. Today, we will be discussing sex hormones. The gonads produce steroidal hormones which have androgenic, estrogenic, and progestational activities. Their synthetic analogs have similar or antagonistic actions and form a very important class of drugs. Firstly, we have androgens. These are substances which cause development of secondary sex characters in the castrated male. It is subdivided into two, natural and synthetic. Natural androgens are produced in the body, while synthetic androgens do not have the same molecular structure as the androgen in the body, but the body converts them to a usable form. The following are natural androgens. Firstly, we have testosterone, dihydroxytestosterone, dihydroepiandrosterone, androstenedione, and androsterone. Hydroxytestosterone is more active form of testosterone. Meanwhile, dihydroepiandrosterone is a weak androgen with potency of 1/20 to 1/30. On the other hand, aldosterone is a metabolite of testosterone which is excreted in the urine. It has 1/10 the activity of testosterone. Next, listed below are synthetic androgens which are orally active. Firstly, we have methyltestosterone, floxymesterone, testosterone undecanoate, and mesterolone. Now, let us proceed to the actions of androgens. Firstly, it acts on the sex organs and secondary sex characters. We have the growth of genitals, growth of hair, and thickening of skin. Secondly, it acts on the testes, which results to the normal spermatogenesis and maturation of spermatozoa. Thirdly, it acts on the skeleton and skeletal muscles, which is responsible for the pubertal spurt of growth in boys and to smaller extent in girls. Lastly, we have the erythropoiesis, which results to the acceleration of the process. Let us continue to the pharmacokinetics of androgen. Testosterone is inactive orally. Intramuscular injection of testosterone is also of short duration. Metabolites of testosterone are androsterone and ethylcolanolone. Additionally, plasma is 1/2 of time of testosterone, which is 10 to 20 minutes. Furthermore, synthetic androgens, which are methyltestosterone and floxymesterone, are metabolized slowly and have a higher duration of action. Going on, let's have the uses of androgen. It is used in the following: testicular failure, hypopituitarism, and AIDS related to muscle wasting. It is also used in teaser bulls, where testosterone-treated cows were as effective in ostrich detection as surgically altered bulls. Now, let's talk about anabolic steroids. These are synthetic androgens with supposedly higher anabolic and lower androgenic activity. Anabolic, wherein androgenic activity ratio of testosterone is 1. Compounds with ratio greater than 1 are called anabolic steroids. Listed below are anabolic steroids. We have trenbolone acetate, nandrolone, oxymethylone, stranzolol, and methandienone. To put emphasis, trenbolone acetate have weak androgenic activity and greater anabolic action, which is used as only anabolic steroid used in cattle for growth promotion. Further, let us talk about the uses of anabolic steroids. Firstly, as growth promotion. Only trenbolone acetate or TPA is used for growth promotion in cattle and to a lesser extent to sheep, but not in pigs or horses. Subcutaneous implantation in the ear of cattle is done for administration of the drug. In addition, it is used as enhancement of physical ability in athletes. When administered during period of training, anabolic steroids can increase the strength of exercise muscles. However, effects are transient, and contrary to popular belief, there is no scientific evidence that performance is enhanced. This is considered an abuse, and anabolic steroids are included in the list of dope tests performed on athletes before competitive games. Going on, let's talk about anti-androgens. Anti-androgens is also known as androgen antagonists or testosterone blockers. These are a class of drugs that prevent androgens like testosterone and dihydrotestosterone from mediating their biological effects in the body. Listed below are anti-androgens. We have delmadainone and cyproterone. Delmadainone is recommended for the control of hypersexuality in male cats and dogs and for relieving prostatic hypertrophy. Meanwhile, cyproterone is a derivative of progesterone and is a competitive antagonist of dihydrotestosterone. It is used in the treatment of male sex offenders. Proceeding, let's talk about estrogens. Estrogens are substances which can induce estrus in spayed animals. It is subdivided into two. We have natural estrogens and synthetic estrogens. Listed below are natural estrogens. Firstly, we have estradiol, which is described as the major estrogen secreted from the ovary. It is also considered as most potent. Estrone is formed when estradiol is oxidized in the liver. On the other hand, estriol is formed when estrone is hydroxylated. Lastly, we have equilin, which is the 1/5 estrogenic potency of estradiol. To note, natural estrogens are inactive orally and have a short duration of action. Listed below are synthetic estrogens. We have steroidal estrogens and non-steroidal estrogens. Steroidal estrogen include ethinyl estradiol, mestranol, and tibolone. On the other hand, non-steroidal estrogens include diethylstilbestrol, which is used orally, zeranol, which is an analog of naturally occurring plant estrogen, zearalenone. Going on, let us proceed to the actions of estrogens. When act on sex organ, it brings out pubertal changes, which is the growth of uterus, fallopian tubes, and vagina. Also acts on secondary sex characters for the development of mammary gland, pubic, axillary hair, feminine body contour, behavior, and etc. Additionally, it acts on the metabolic effects, which are estrogens are anabolic similar to but weaker than testosterone. Furthermore, it acts on maintaining bone mass, primarily by retarding bone resorption. Osteoclast pit formation is inhibited and there is increased expression of bone matrix such as osteonectin, osteocalcin, and alkaline phosphates, etc. Let us proceed to the pharmacokinetics of estrogen. Natural estrogen are inactive orally. Estradiol esters injected intramuscularly are slowly absorbed and exert prolonged action. Ethinyl estradiol is metabolized very slowly, orally active, and more potent. Now, let us continue with the uses of estrogen. Firstly, it is used as or for hormone replacement therapy to avoid vasomotor disturbances, genital atrophy, osteoporosis, dermatological changes, psychological disturbances, and lastly, increased risk of cardiovascular diseases. To note, estrogen hormone replacement therapy is highly efficacious in suppressing the menopausal syndrome. Additionally, it is used for growth promotion in animals. Estradiol increases nitrogen retention, growth rate by 10 to 20% in steers, lean meat content by 1 to 3%, and feed efficiency by 5 to 8%. Estradiol can be used in steers to best advantage but has some metabolic effects in heifers and veal calves. It works best in lambs in conjunction with androgen and is not effective as an anabolic agent in pigs. Another use of estrogen is the induction of lactation in cow. Listed below are anti-estrogens. We have tamoxifen and clomifen and cyclophenol. Tamoxifen is an anti-estrogen used in the treatment of estrogen-dependent breast cancer in women. Clomiphene and cyclophenol are also anti-estrogen which inhibit estrogen binding to hypothalamus and its anterior pituitary, preventing the normal feedback of estrogen, causing excess secretion of GnRH and of gonadotropins, resulting in the increased estrogen secretions and ovulation. Let us talk about progestins. These are substances which convert the estrogen-primed endometrium to secretory and maintain pregnancy in animals paid after conception. Progestin means favoring pregnancy. It is subdivided into two. We have the natural and synthetic progestins. Natural progestins are listed below. We have progesterone and hydroxyprogesterone caproate. Among these drugs, hydroxyprogesterone caproate have longer acting injection. Meanwhile, listed below are synthetic progestins. We have megasterol acetate, dihydrogesterone, medroxyprogesterone acetate, melangesterol acetate, and prolegestone. Among these drugs, medroxyprogesterone acetate is a weak androgenic. Meanwhile, melangesterol acetate is orally active and used to suppress estrogens in flattening female cattle. Now, let us proceed to the actions of progesterone. It acts on the uterus, which brings about secretory changes in estrogen-primed endometrium, hyperemia, torticosis of glands, etc., and decreases sensitivity of myometrium to oxytocin. Second, it acts on cervix, which converts the watery cervical secretion to viscid mucosal plug. Thirdly, it acts on the mammary gland. Proliferation of acini of mammary gland, and in combination with estrogen, it converts udder for milking. Fourthly, it acts on the CNS. High circulating level of progesterone appears to have a sedative effect. Fifth, body temperature. It causes a slight rise in body temperature, restoring the hypothalamic thermostat. And lastly, 6, it acts on the pituitary. Progesterone is a weak inhibitor of gonadotropin secretion from the pituitary. To further, let's have the uses of progesterone. It is used as contraceptives in women. It is used for hormone replacement therapy along with estrogen. Progesterone is also given in HRT for a few days to avoid chances of endometrial carcinoma. Third, threatened or habitual abortion. Fourth, it is used for postponement of estrus in bitches. Fifth, it is used for induction of lactation in the cow. And lastly, it is used for synchronization of estrus cycle. For antiprogesterone, which are antiprogestins that may act as abortifacients, we have mifepristone, along with a prostaglandin derivative, proved to be very effective in terminating early pregnancy in women. That ends our discussion for sex hormones. Let's proceed to thyroid hormones. The thyroid gland secretes 3 hormones. We have thyroxine, which is a T4, triiodothyronine, which is a T3, and calcitonin. The former two are produced by thyroid follicles, have similar biological activity, and the term thyroid hormone is restricted to this only. Calcitonin is produced by interfollicular C cells and is chemically and biologically different. Let's proceed to the chemistry and synthesis of thyroid hormones. Both T4 and T3 are iodine-containing derivatives of thyronin, which is a condensation product of 2 molecules of amino acid tyrosine. For thyronin, we have the tyrosine plus tyrosine. For T4, we have the 3,5,3,5 tetraiodothyronin. For T3, we have the 3,5,3-triiodothyronin. Take note, the thyroid hormones are synthesized and stored in the thyroid follicles as part of thyroglobulin molecule. To further, let's talk about the steps in synthesis and release. Step 1, the iodine uptake, blocked by thiocyanate, perchlorate, and cardiac glycosides. Thyroid follicular cells have an active transfer process to concentrate iodide in them. Step 2. Oxidation and iodination. Iodine trapped by follicular cells is oxidized by peroxidase enzyme with the help of H2O2 to iodinium ions or hypodious acid. These forms of iodine combine quickly with tyrosine residues of thyroglobulin to form monoiodotyrosine and diodotyrosine. Step 3, we have the coupling. Monoiodotyrosine and diiodotyrosine will resort to T3. Diiodotyrosine plus additional of diiodotyrosine will result to T4. Next step, we have the storage and release. Thyroglobulin contain iodinated tyrosyl and thyrionine residues are transported to the interior of the follicles and remain stored as a thyroid colloid till it is taken back into the cells of endocytosis and broken down by lysosyl proteases. The T4 and T3 SOR release is secreted into circulation while MIT and DIT residues are deionated and the iodide released is reutilized. The last step, peripheral conversion of T4 to T3. Liver and kidney convert T4 to T3. About 1/3 of T4 secreted is converted to T3. T3 is 5 times more potent than T4, although T4 is secreted in much excess. Take note, thyroid-stimulating hormone or thyrotropical hormone regulates all stages of this process from iodide uptake to the final discharge of T3 and T4. Next, let's proceed to the actions of thyroid hormones. Firstly, it acts on the growth and development. Secondly, it acts on the intermediary metabolism such as lipolysis, glycogenolysis, and overall negative nitrogen balance, wasting condition, and weight loss. Also, it acts as calorigenesis. T3 or T4 increase BMR by stimulating of cellular metabolism. In addition, it acts on the cardiovascular system which causes hyperdynamic state of circulation. Also, it acts on the nervous system which result to cretinism or mental retardation, Graves' disease which result to anxious, nervous, excitable condition and exhibit tremors and hyperreflexia. In the GIT, propulsive activity is increased, hypothyroidism which result to constipation and hyperthyroidism which cause diarrhea. In hematopoiesis, it maintains the normal state. Let's continue with the preparations of thyroid hormone. First, we have the L-thyroxine sodium. The EVO form is twice as much active than the racemic mixture. Maximum effect is produced in 10 days. For liothyronine sodium or T3, maximum effect is produced in 1 to 2 days, less chances of cumulation. Listed below are antithyroid substances. Firstly, we have natural goitrogens or goitrine, which certain plants of genus Brassica, such as cabbage, turnip, etc., which contain a compound of goitrine which has antithyroid activity. We also have thionamides, which include propylthiouracil, methimazole, and carmazole. Lastly, we have non-thiouracil antithyroid agents, which include ipodate and radioactive iodine. Antithyroid substances find occasional use in the treatment of hyperthyroidism. That ends my report for thyroid hormone, and that would be all for the drugs acting on the endocrine system. Thank you!